I think it's so important to encourage young people, especially with epilepsy, to be independent with their condition. We start with, are you aware what epilepsy is? Are you aware what happens to you? And we're doing a really good job if we can help support them to be more independent with their condition, manage it better, and be confident. They do better physically, emotionally, psychologically, and the comorbidities go down as the education goes up.
Transition begins from our first meeting of the patient, and it's not just about us as nurses promoting the independence, it's about the doctor that you meet, the health visitor that you're in contact with, or the school nurse that comes in as part of your journey. We want everybody to be involved and to be so that the young people feel really supported.
Hopefully we can empower people to say, we've managed to do something, what can you do? How can you make some transition happen in your service? And maybe it's not doing an extra clinic, maybe you do clinics already, but it's how you work in those clinics.
Well, one of the small steps that we implemented following our visit to London to the Roald Dahl conference was an idea of directing your clinic letters, so your summary of your consultation, actually to the young person themselves. And that's something that we hadn't thought about, just an easy, simple idea that we could implement.
It's really scary going to adults where they don't know anybody, and we found that doing our transition clinic jointly, it means when they move to adult services, it's a familiar face.
For us as Roald Dahl nurses, one of the measures of success is that children attend clinic. We have a good attendance, high attendance rate within our clinics.
We know when we've done a really good job with a family is when they've been up here with anxiety when we meet them, and what we find is when we support them, when we educate, we empower, we advise them, we find that they need us less, and that for us is an absolute measure of our success.